Now in your health, 45 Vermont lawmakers sent a letter to the UVM Health Network's president today, urging them to reconsider their proposed service cuts. Network leaders announced those cuts 2 weeks ago and are not reversing course despite the continued backlash. I spoke with people on both sides of the issue today to learn what comes next.
Medicine's supposed to be one of the highest ethical callings. This sinks it to the lowest level of politics.
Hey, healthcare horns, everybody!
1 week after healthcare workers took a stand against proposed service cuts, Vermont lawmakers are joining their call, asking UVM Health Network leaders to find different ways to meet their budget order. 45 lawmakers and Lieutenant Governor-elect John Rogers sent this letter to the network's president, Dr. Sonny Eapen, Tuesday afternoon, saying, quote,
reconsider these cuts, commit to working with the Green Mountain Care Board, find a path forward that keeps these necessary services open and available to those that need them.
In October, the Green Mountain Care Board found the health network went millions of dollars beyond its 2023 budget and told them they need to make up the difference in the coming years. Leaders within the network say that led them to the difficult decision of planning future cuts to dialysis programs, psychiatric care, entire health clinics, and more. And they still say that is their best path forward to both live within their budget and minimize impacts to patients.
We've clearly heard from our communities that they do not like the actions that we have to take. We don't like them either. We are required to reduce the revenue that the network brings in. Reducing revenue requires us to reduce services.
Some legislators who signed on to the letter argue the move is unethical and want health network officials to meet with them to go over new ideas.
We have a right to expect that our flagship healthcare organization acts like an adult. They asserted using a health equity lens in making decisions about cuts, but targeting the group of one of the most discriminated against healthcare needs.
One thing both sides agree on amid all this, Vermont's healthcare funding system is broken, and discussions are needed on how to make sure this doesn't happen again.
I think we have to come together as a state, come together and figure out how to take some pressure off commercial insurance.
This is not only happening in the northern part of the state. Closures are happening in the southern part of the state, and we really need to have a conversation statewide about what's happening.